I am a pelvic health physical therapist in New Jersey. I have my pelvic health clinic where I primarily see pelvic pain patients and pregnant and postpartum women. I see men, I see pediatric patients as well. I've been doing pelvic health since almost 10 years now. And I was in India last year. I'm not sure how many of you met me in India. I am glad to see you all again if you did meet me, and truly impressed by Malaka for getting everyone on the same platform. I think that's Malaka, why don't you mute all the participants?
Yes, I have muted all of them. Yeah, everybody is more or less muted. Okay, so anybody has a question, you can just go and ask. Hello?
And English or Hindi?
Bilingual would be better, but yeah, I think mostly everyone understands English, so not an issue. Okay, so first you can just explain the relationship between pelvic floor and IC. That you can start with. I'm sure questions will come.
Sure. So I think that would be a good start. So when you look at IC, right, it starts from the bladder. We know that there's something going on in the bladder. There is some inflammation going on, but it doesn't stop at the bladder. So an easy example would be, we think of IC as a chronic condition. That means it didn't start in a week and then, you didn't have symptoms in like a week or a month. It has been going on for a couple of months at least before you even get diagnosed. So I would give an analogy that, say for example, there's a fire that started in a garage, right? And now it took the whole house. You're not only going to put the fire off in the garage, you're going to take care of the whole house. So it's the same with IC and pelvic floor. Even though it started from the bladder, now you have all these other systems and body parts that are also involved. And it's said that almost 70 to 80% of the patients with IC have some kind of pelvic floor dysfunction, mostly hypertonic pelvic floor. So that is why, because of this close relationship of the bladder and the pelvic floor, it is very important that we look at the pelvic floor and treat pelvic floor.
Yeah, there is a question from Vaishali Goel. She's asking, is there any correlation according to your findings? Back pain and IC.
So similar thing what I mentioned here, but so a lot of nerves start, so all your nerves, right? The back has the whole spinal cord that starts from the brain and then goes into the spine. And then your nerves originate from the back and then goes into different parts of the body. And there are nerves that goes from the lower back into the pelvic floor and into the legs. So it can be both ways. There can be some inflammation or injury in the pelvic floor or bladder that can radiate pain through those connections to your back or your leg or your abdomen, and then vice versa. Like there can be back injury a lot of times actually that have been seen to radiating pain to your pelvic floor as well. So especially for IC, we talk a lot, and I know Dr. Mahesh Menon talked a lot about this pain science, and he spoke very nicely about the mind-body connection, the pain system and everything. So because of the same reasons, there is nervous system upregulation. That means your nerves are now hypersensitive. So that means, say for example, if I touch my arm, this shouldn't give me pain, but if I have nerves that are firing constantly, this touch might give me pain. So a lot of times that goes on for chronic pain conditions, and that can give you these pain signals that go haywire and give you these different pain, different sites that are now painful, basically. Can you?
Hello?
Yeah, there are a lot of questions. Yeah, go ahead.
Yeah, yeah. Bhavati, just tell me, what is the relation of IC with your menstrual cycle, because it's very odd. Like sometimes before, when I used to get my menstrual cycle after I was diagnosed, I used to feel fantastic. Like I used to feel like a normal person. And the day my period would be over, like on the fifth day, the troubles would seep in. But now, uh, I don't know. It's a little confusing because now I'm bad the first day and then I'm suddenly really very good. So, what is the relation between IC and the menstrual cycle, like with the relation with the muscles?
That's a great question. So what the research says right now, right? It's not very clear, but what the research says right now, it's somewhere related to estrogen. So when your cycle's going to start, or during ovulation, is when a lot of IC patients start having pain, more pain than usual, or pain. And if so when the estrogen spikes, is what they've said, that like IC patients suffer from like this small flare or trigger. So
Okay.
what have helped a lot of people is going on the contraceptives to balance out that hormone.
Okay.
That
But
makes
why do I feel better when I get my period? What's the reason for that? Because the estrogen level it decreases then and the progesterone? Like,
it's related to the hormones, and that's what happens in most people. But I would suggest to get the hormones checked for you individually, of what is exact, if there is any imbalance with the hormones, and to get that corrected, and that usually helps a lot of people.
my hormones and all are normal. I have got all that checked. But
Okay.
isn't there any muscle, physiologically, any muscle changes? Because your uterine muscles do contract when you're getting your periods, right? So is
Yes.
there anything, any relation with the IC, or they relax, in fact, when you get your periods? So,
No, it's not that they relax or contract or anything. When you are going through when you're going through menstrual cycle, yes, there is some contractions, and that can be, but there's no direct pelvic floor connection in general
okay,
during the
okay,
apart from like the hormonal connection that I know of.
okay,
Okay.
okay,
But
okay.
like I said, your pelvic floor is definitely, I mean, responsible for your symptoms. I've seen this actually a lot in the endometriosis patients as well, and treating the pelvic floor has helped these symptoms of the pain, even if it's cyclical.
Okay,
I
okay.
just have a general instruction to all the participants. Bhavti is a pelvic floor therapist, so please ask questions related to your pelvic floor dysfunction or your pain, pelvic pain. Please don't ask her generic question about IC, like what diet to follow and everything. We would like her to concentrate on our pelvic floor therapy. So the next.
So, do you have any special exercises or any special pelvic floor therapy to be done?
You're breaking up, but the exercises are very individual, right? I cannot tell you
Okay,
that do these 3 exercises and you'll be great. I mean, you might flare out
okay,
with those.
okay,
The good start would be to get yourself evaluated for the or I mean, you can even do a self evaluation if you are taught for the pelvic floor, if
okay,
you don't
okay.
have access to a practitioner, or if you know that, all right, you have some pelvic floor dysfunction going on, then doing some self techniques, which I can't like discuss in this session, but doing some self techniques and help with.
Mitesh wants to ask about what are the relaxation therapy.
So there can be a lot of relaxation therapies. As far as the pelvic floor goes, the first thing would be to uh, decrease the tone of your pelvic floor. That means if you have tightness in the pelvic floor, the first thing you would do is to decrease that tightness. you can do that by a lot of ways, but most effective would be to do internal pelvic floor, probably internal pelvic floor therapy. You can also do some mindfulness and breathing and all, which helps. So it's, if you cannot do internal right now, there can be all these other alternative therapies that would definitely help to just relax overall your muscles and just the overall body tension that helps with the symptoms. So it's not just, so here's the thing, right? When we talk about pelvic floor tightness, specifically for IC, it's not that you're only relaxing your pelvic floor muscles, you're basically reducing your overall body tension as well. Because when your pelvic floor goes in spasm or when you experience pain, your whole body is going to react to it in some or the other way. So when you, yeah, go ahead, Balaka, you were saying something.
No, I am just saying Vaishali Goel has some questions. So after this, please ask. Vaishali?
Yeah, hi Bhavti.
Hi, Vishali.
I just wanted to ask, is there any short assessment that we can assess male pelvic floor? And is there any correlation with lack of erectile dysfunction due to pelvic floor spasm?
You mean lack of erectile or you mean erectile dysfunction?
Erectile dysfunction.
Yes. So there can be two things. You said pelvic floor spasm.
Yeah. Do pelvic floor spasm leads to erectile dysfunction? Is there any assessment that we can do quickly to assess male pelvic floor?
I mean, if you say quickly, are you a physical therapist?
Yes, I am a physical therapist and I have a patient which is with the same complaint.
Do you do internal physical therapy? Have you done?
I do, but not on males. I do on females only.
So I mean, it's basically, if you know how to assess the muscles, just for males, you just have to check the same thing rectally.
Okay, rectally. Yeah, that's what I want to confirm, because I do with vaginal examination, so I wanted to ask for males.
Yeah, just do it.
Sometimes they're not comfortable with that. Going into the rectum, they're not comfortable with that.
I mean, that would be the most accurate thing to do.
Okay.
Obviously, if there's a lot of pain, then you have to grade it, but that would be the thing to do. Okay. The symptoms can also tell you, so you can just do like the treatment techniques to down-regulate the pelvic floor.
And can the hypertonicity of pelvic floor or spasm of pelvic floor lead to erectile dysfunction?
It can, yes. Because if there is spasm, right, the blood flow would be interrupted. The prolonged tightness can also lead to weakness.
Can it lead to catheterization also?
That's a whole different thing. But yes, catheterization can be a lot of things. If the patient having problem with emptying, then they have to cath themselves, or the doctor does it. But that obviously that they have to circle back with their urologist or urogyne to do that.
Okay, thank you.
Yeah.
So there is a question from Dr. Sarita Narang. She is a urogynecologist from Bombay. She is with us. Dr. Narang, please go ahead.
Yeah, hi. Am I audible?
Hi.
Yes, you are.
Yeah, hi, Bhavti. I'm a urogynec in Mumbai, and I see a lot of patients of interstitial cystitis. And yeah, definitely there's quite a scarcity of pelvic floor specialist, physiotherapist who actually knows how to assess the pelvic muscles, as well as, how to really help the patients. And invariably I'm seeing these days, most of them end up teaching patient Kegels exercises, which are actually contraindicated in cases of pelvic floor spasm. So is there any biofeedback software available, or how you people go about assessing really a pelvic floor spasm, and what kind of biofeedback clinically which can be done with minimal setup with people? Even if I call physiotherapist who apparently says, yeah, they know, and I have few of them which are good, But are there any biofeedback software, simple models in which, on phone patient can be trained, like particularly in this lockdown time? There are patients who are calling me for help, but then it sometimes become very difficult to talk on phone and take them through, these things. So can you just guide on that? I can't hear you. Is it that my phone is off or? Yeah. Yeah.
Yeah, so there is one company that most of the PTs use in US, which is Prometheus. So what I usually do is right now, right, I'm in the same boat. So my patients are home, and few of them have their own the biofeedback units that have taught them to use. So
Okay.
it's pretty simple. They can have the external or internal electrode, which they hook up with like a small pocket device, and then once you teach them what to look for, they can do it themselves.
Okay, so maybe I'll connect with you again later if I can get that kind of
Definitely.
contact from you, and I can send that across to my patients.
That
Thank you
sounds
very
good.
much. Yeah.
Definitely.
Yeah. Thanks.
Balaka, I think you're on mute.
I think Mitesh has another question regarding TENS therapy.
Yes. What is the question?
Mitesh?
Role of TENS in IC. Well, TENS is basically a pain reduction modality, and the way it works is it so there are nerves that carry pain sensation to your brain, right? So TENS, what it does, it targets the nerve fibers that have a larger diameter than the ones that carry pain sensation to block the pain sensation. So I mean, it's actually a very good modality to reduce pain, especially when you are in say flares, right? You can just put the electrodes around the bladder or wherever you have pain, and that helps you. You can even just keep it on if you have the pocket for the suspension. Did that answer your question?
Mitesh?
Hello.
Yes. Did that clear your question?
Yes, I got it. Thank you, ma'am.
Okay.
Thank you.
Bhavti, somebody also wants to know about the role of nerve block in.
Sure. So I work very closely with the physiatrists and the pain medicine doctors, and especially for chronic pain patients or acute pain, actually, or especially when you have times when you have flares, nerve blocks are a great modality for getting out of that pain loop, right, or pain cycle. And once you are out of that, you can actually focus on your pelvic floor physical therapy. Because if you come to me with like an 8 and 9 pain, we are limited with what we both can work together with. So if you're asking me if I like nerve blocks, I mean, I'm not, yes, nerve blocks do help a great deal for a lot of patients. If you have to make sure that you go to a specialist, and you have to choose the right
In
specialist.
India, we don't really have that kind of trained pelvic floor therapist. So, if a patient goes to a pelvic floor therapist, an IC patient, what would be the protocol that you would follow? Like what we can expect?
So the first thing would be, so here's the thing. If you go to a pelvic floor physical therapist, right, what is your goal? To get rid of pain or to get your bladder symptoms in control? Going to a pelvic floor physical therapist does not necessarily mean that you have to do the internal. You need a physical therapist who understands pelvic floor and the connection to all your symptoms and the body, and can still treat it without doing internal as well. So it does not mean, I have like a lot of patients, especially say for example, vulvodynia, right? if a vulvodynia patient comes to me with like a 9 out of 10 pain, they have this catastrophizing, they're fearful of say internal, or they had like an abuse history, or they had like a bad experience with internal like prior to coming to me, I'm not going to do internal like in the first session or even 2 sessions until the patient is comfortable and confident about going ahead with the treatment. Because if I start doing the internal regardless, that's actually going to make them worse, right? So if you go to a physical therapist, the important thing is they understand IC first of all, they understand pelvic pain, they understand in what ways it relates to your pelvic floor and the whole body. And then once you talk to them about your symptoms, they explain you what is going on, what the plan is. And then if you guys move ahead, it can be anything. It can be starting with like looking at your whole posture. So for example, looking at your breathing pattern, teaching you how to get out of the behaviors that are causing symptoms for your pelvic floor. Just starting with those simple things can also help a great deal, even without doing the internal.
Dr. Narang has another question. She has written on the chat.
Dr. Narang.
The iPhone, the last one.
Yeah. Shall I speak?
Yes,
you're not able to find the
yes,
chat? Okay,
yes.
when you just mentioned the vulvodynia thing, the thing is, I have couple of patients in which vulvodynia has actually progressed to allodynia and has gone to CRPS, actually, complex regional pain syndrome as well, with central sensitization to a very bad extent. Now, when they first come to me, actually, they have gone to so many doctors and they have got, so many feedbacks with multiple experiences of different physiotherapists. And many times, I come across that, a little bit aggressive approach from the PT side, have given them bad flares, like vulvodynia, and, somebody just want to go ahead with an internal or even basic assessment at times, I have come across they flare up badly. And it just triggers the whole series of, sensitization and progresses more. So I also struggle with those presentations when patients come to me with bad experiences previously, and many times, it takes 1-2 sessions just to calm down and neutralize the effect of those things. So I wanted to know, your experience, that how you deal with these kind of patients, and what is the point where you actually take a step forward and how you desensitize them. Means what exactly you want to do in the pelvic floor when they are already gone into a central sensitization thing. So that will be very helpful if you can elaborate a bit there.
So that is a great question, and I mean so important for IC patients and patients with like the CNS upregulation.
Yeah.
Right. So for all the chronic pain patients, in fact, for all the pain patients and all the pelvic floor patients, my approach is outside in. I always start from their hips, their back, their abdomen. Once they start to get comfortable with what we are doing, confident with what we are doing, then I go, after taking their permission, with the internal, and I'm very gentle. We start only with the touch on the outside first. If they are able to, if they are okay with that, just simple touch, then we go internal. For a lot of vulvodynia patients, it's really difficult. And then vulvodynia combined with like CRPS and all, we might not even get to internal for like probably a month.
Right. Yeah. So have you ever come across anyone who ended up with a bad flare, and how did you manage them? Like one of my patients, I just was there after second, third visit to my clinic, and I just wanted to assess with a very gentle examination also, just to look for trigger points, and she ended up with flare the next day by the time evening she reached. So do you have any standard set of protocol where a PT in those situations can help, or shall we just stop it for a while? Because many times they just lag totally because the experience becomes so bad they don't want to even come back, for next visit also.
Yeah, especially when that happens. I mean, that whole, all the pain areas, light up. So I feel that doing simple, say, so if I've had like one patient I had seen for clitoridynia, and even after like even with just touch around the area, she had a bad flare up. So what helped was, what I usually tell these patients is to, if they are taking any pain medications, to take that medication before the session. And then also just doing simple like lymphatic massage or lymphatic in the abdomen and the thigh helps to calm down those areas as well. I try to say if they are having flare, then definitely I'm not
Okay.
doing any pelvic floor work with them. I'm doing other things like like some back work or abdominal work. Abdominal work helps a lot. I've seen with all the ICM patients.
Okay.
Vaishali Goel has another question.
Thanks.
It's in the chat.
Thanks, Bhavti. Thanks. Yeah. Thank you, Bhavti.
Vaishali has a question.
Yeah, hi Bhavti.
Hi, Vaishali.
Yeah, one of my patient, whom I told the exercises, and she did it. I mean, did it more than thrice, 4 times in a day. Could overstraining could be the reason that she'll end up again into the IC and going for the catheterization. Could be a severe pelvic floor muscle spasm. Could be the reason, because I'm not able to go to her, and she's not able to visit me because of this lockdown and everything.
What,
Could it be the
like,
reason?
talking about what exercise? Pelvic floor or like general
I
stretching?
told her relaxation. I told her relaxation. Only simple pelvic floor relaxation exercises and breathing exercises. I basically work on breathing, diaphragmatic breathing.
Yeah,
I told
just
her that, and
sorry to interrupt, Vaishali. Could you just give us a general introduction about yourself? Where are you from and where you practice?
I am Vaishali, working as a junior physiotherapist in Apollo Hospitals, Delhi.
I think I met you, Vaishali.
Yes, I met you in that session
So,
that you took in Apollo.
right.
Yeah.
So, when you say pelvic floor relaxation, what does that mean?
Pelvic floor relaxation, like going into the butterfly position and inhaling and then exhaling and relaxing the whole pelvic floor.
So here's the
And
thing.
doing onto the ball, like on gym ball and everything. I have a complete session which I go through with the patients. I have told her the home exercises, mainly with the breathing and there's a combination of breathing and relaxation, pelvic floor relaxation, which I am performing and which I asked her to perform. She was doing it with me from past 15 sessions, and due to this lockdown, she's not able to do it with me. And I'm also not able to connect with her. So she just gave me a call and said ki she's having a severe pain and going for catheterization every 5th day. And now I asked her not to do the exercises because I got to know that she's doing it thrice and fourth. At that time, I thought that it could be the overstraining of pelvic floor muscle, which is leading to the spasm and leading again to the flares of severe IC. So am I going into the right direction or not?
No. So when you are thinking of flares of IC, it's not only pelvic floor. There can be so many other factors for flares.
She has a severe back pain history with the multidiscal issues also.
So, and also like just the whole lockdown situation, right? That is stressful for a lot of people. Stress can actually even cause IC.
Yeah, that's what. Yeah, my previous question was that only, that could stress could lead to the severe IC symptoms also, like psychologically.
Yes.
Because
So
I think that
stress can be
plays
a
an
part
important
of
role.
it. Stress can be a part of it. It can definitely affect the IC symptoms or like lead to
Can lead to
one of
spasm.
the symptoms, right? If you are asking about pelvic floor exercises and then overdoing can do it, if there is any nerve issue going on, then a lot of stretching can also actually aggravate the nerve irritation.
Okay, but there was no, as per her report, there was no nerve involvement.
Okay.
Because I think that continuously thinking about it and doing in every 2 hourly and like that could lead to more into this situation, that the severe it could be like severe spasm. She went into a severe spasm situation, and not able to pass the urine, because now no pain, nothing, it's just she's not able to pass her urine. She has to go for catheterization, which is the most important factor in this case.
So I'm not sure actually. If you tell me that all right, she did these 3 exercises, and if that can, I'm not sure if those were the only reasons, because this is like a very vague situation for me to assess.
Okay.
Does that make sense?
For me too, that's a vague situation. That's why even she messaged me to ask you. That's why I'm asking you. She's somewhere here only.
If she wants to give me more information, and then I can actually maybe give like my opinion of what I think. But at this point, if she's already cathing, right, I think she should circle back with her primary care doctor.
Not listening to primary care.
Like the urologist or whoever it is.
Not listening to primary care.
I can't. Not, what does that mean?
That means that she thinks that it's something different.
So her urologist thinks it's different?
No. Patient thinks that it's different.
I still don't understand.
What Dr. Goel wants to say is, I think that the patient is not listening to the urologist, and she herself is kind of self-diagnosing this thing. Or do you mean that, Dr. Goel?
Yes. Self-diagnosing and
Going
more into the situation.
Yes.
Yeah, I really like whenever
overutilization or overthinking. I want to focus onto that. Can psychologically your pelvic floor muscle go into spasm? Could it be the reason?
Yes, definitely. It can be the reason. But the important thing is right now, she is in a situation where she has gone to cathing, and I would not be comfortable just by myself on the team. I would definitely like to involve whoever the primary care is at this point and get her out of that cycle first. It's not going to happen only with physical therapy. You need some kind of other help with that.
Dr. Narang wants to suggest something here. Dr. Narang?
Hi. I really was, it's a very interesting case which Vaishali is discussing here. There are patients. Is it okay if I give my suggestion, because I should ask a question from Bhavti actually?
I'm seeing that patient from, I guess, past 6 months or more than that, and once she's with me, she's fine, and once she's not with me, she's not fine.
See, the thing is, most of these IC patients, they have been rejected so many times when it has come to their pain, their sufferings, the kind of psychological trauma they have gone through. And it's a sad state that most of the time they have been rejected and dismissed by doctors themselves, the primary caretaker.
Primary care of a primary care is very more into the patient and very very caring about the patient.
I understand. But what happens, I agree that, it's good that if she is connecting with a good primary care physician or a urologist or a gynae, has a good rapport. So there, that connection with the three of you, the patient, the primary physician or the primary care doctor and the PT, that's the crucial. Because what happens,
we are connected.
So you are able to connect with the doctor and can update the situation.
Yes.
But what happens, there has to be a reason that why
every time
why a patient doesn't want to but the patient doesn't want to go back to the physician but want to come to you. Maybe she finds solace in talking to you and she has got a connect with you already. And what happens, this so the thing is, it's good to be available to them, but if you feel at a certain point of time you are also finding yourself sort of helpless in situation, trapped sort of a thing, that I want to help, but how much I can help and what to do next. And
in that
this
situation
kind
only
of
I am.
In this kind of lockdown, if somebody feels that I don't want that, I am missing out something in this case, is there actually something going on? There could be a possibility of a new UTI which has developed suddenly and she is not able to pass
I saw
urine.
her reports also. She got the reports done and there's no sign of UTI.
There's no sign of UTI. And if you feel that there is no active UTI, then the only
Hmm.
reason, and you are saying that there are back issues as well, there are multidiscal
And she don't
problems.
want to even go for cystoscopy also.
Yeah,
She has
see,
been
yes,
referred for cystoscopy, but she didn't want to go
but
for
she's
that.
not.
And there are some
So,
issues for that
yeah.
also.
So there are two things. It is like you want to help, and the second is patient want help. But the thing
Yeah.
is patient looking for a real help in terms of actual treatment, or she is looking just for a solace at the moment, a hearing, a listening ear?
No, our real
Yeah,
help was she's being troubled by going for regular catheterization. Also, if we are
yeah,
on her part, we will not go
yeah,
for the
yeah,
catheterization again and again. She's being
yeah. So
troubled by catheterization.
catheterization, and if she is
Yeah.
not able to catheter, she is not able to pee. So
No,
at
no,
the
no, no.
moment,
And she said,
we have
I'm
put
feeling,
some.
I mean, even when the patients
Mhm,
are with prolonged spasm and everything, they can
mhm.
identify that is there spasm or not.
Yeah,
She
yeah,
gave me a
they
call and
know.
said, there is no spasm. I cannot feel any tightness. I cannot feel anything. I'm no pain. But
Understand.
the only
So
thing is I'm
the
not able to
yeah,
pass my urine.
yeah. So the only reason which I can here understand, either there is some progression in the neurogenic bladder component, which could be because of an underlying spinal issue. Second thing,
Mm-hmm.
UTI you have excluded. So
Yeah.
either you ask her, are there any other neurogenic components also coming up now? Numbness in the legs,
Mm,
failure to pass motion also. Is she finding it difficult to pass
once
motion
she
as
told me
well?
that she's having some kind of swelling in her thigh, which is
Mm-hmm.
not, matlab, maybe you were overthinking about it because she has
Yeah,
some issues with
definitely.
neck,
Yeah.
knee, or
Hmm.
back and everything. Matlab,
Yeah.
it's a
Right. See, it's
multi
a
thing.
lot of free time at this point of time when people start focusing also more. Now it depends on the
And she's been
personality of
focusing on that from the
patient.
past many
Yeah.
years.
Yeah. And what happens, there are people who want to focus more on the cure, that now I have got time, let me cure it. Let me go more towards the
Yeah.
solutions
That's
rather
what
than
I want to
problems.
focus on, that she was
Yeah.
doing it more
Right.
religiously, and
Hmm.
like I told
Hmm.
them to do it for limited period of time, like for 30
Yeah.
minutes or 40 minutes, not to, because I think that
Right.
overstrain is straining a muscle
Yeah.
could also lead to spasm, because there is a spasm cycle.
Yeah, but then you say that she can identify there is no pain, no spasm.
Yeah,
She
but
knows that it
she's
is
saying there's
different.
no spasm. Even me
Yeah,
and primary care thinks that
right.
there's a spasm, because we can't even assess
Okay.
right now, but she's
Yeah,
saying there's no
another,
spasm, so we are
yes, agreed. So
believing
another
into that.
perspective, I will tell you, many of what this my experience, what my patients I see, the moment you want to tell them opposite of what they are thinking,
Yeah.
they go into
Yes,
another
yes, yes,
cycle and loop of
yes.
rejection, and it adds
Yeah,
to more stress, more trauma, that what I am saying,
yeah,
people are not able to
yeah.
understand that. The
Even
best
her,
thing what you
yeah,
can do at this point of time is
Uh,
agree to what patient is saying, and then just give
yeah.
her pelvic
Giving
floor
psychological
relaxation.
care from past one
uh,
month.
Yeah, yeah,
I think
yeah.
patient has a question. Arun,
Huh.
please go ahead.
I wanted to add something because I could relate to some of the things ma'am is discussing about this patient. Many times,
Hmm.
most of us have so much sensitization that, yeah,
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 even 10 minutes of that exercise, if we are
yeah,
just starting it, it can flare us.
yeah,
yeah,
For me, it's like if someone is doing exercises normally 30 minutes, for me, that 5 minutes of exercise, if I do, it fails me. And sometimes doctors find it difficult to understand why it is happening if even I'm doing
Yeah.
so much little of the exercise.
Dr. Bhavti, this is a common question we often get, like we often see that exercises flare us up. Why does this happen? That many patients, they cannot do the exercises.
So when you look at IC, right, a lot of patients also have other things going on like fibromyalgia, which might or might not have been diagnosed yet. So again, uh, when you are seeing all the chronic pain patients, don't just rely on what's written in the report, right? Like try to do your evaluation as well if there are any other things that you think are going on. So in those conditions, you have to for IC or for any chronic pain patients or any chronic conditions, always start with like the minimum that you can start with. If the patient might not flare up in the sessions, but they might flare up like after going home or after a day or so. So like you have to wait for that time period to allow your body to react, and then every person has a different tolerance. and you have to know that. So if you go to someone and if they, so for example, give you like X, Y, and Z exercises, you as patients have to know where you can start as, you know, like know your own tolerance.
Yeah, we know our own tolerance, as well as most of the times we know that what actually flared us. Yeah, that it may have triggered our symptoms. Most of the times there is a gut feeling that yes, this would have triggered us.
Right. So the most with IC again, because say for example, again I would go back to the nerves, right? If you have nerves that are sensitive and are already irritated, doing something, so your threshold actually decreases or your tolerance decreases for like certain activities or to take certain sensations. And so because of that, if somebody can do a say 30-minute exercise and you can do only 5, you know, that probably is because of that low threshold to exercises and to take like so like pain or other sensations. So that's why you always start with that threshold, and then you are also building your tolerance and also increasing that threshold, if that makes sense.
Yes, I think there is a question from Afreen. Afreen, Afreen पूछिए. हेलो.
हाँ हेलो.
आप पूछिए.
हाँ बाला का.
हाँ हाँ हाँ.
मेरा ना आज हम लोग का फास्टिंग चल रहा है, तो अचानक हमारा आज मॉर्निंग में ज्यादा पानी भी नहीं पिया था. 1 कप पानी और 1 कप दूध पी के 1 घंटा मैं नींद में जब उठा तो अचानक मेरा यूरिन बंद हो गया था पूरा. तो 1.5 घंटा लगा हमको वो यूरिन थोड़ा थोड़ा करके पास करके फ्री होने में. और जब फास्टिंग में रहती हूँ तब ब्लैडर प्लस होल बॉडी में जलन नहीं आते, लेकिन फास्टिंग खोलने के बाद ही धीरे धीरे फिर ब्लैडर में हल्का जलन आते
आफरीन, ये जो सवाल है ना, ये हम लोग यूरोलॉजिस्ट से पूछेंगे तो बेहतर रहेगा, क्योंकि डॉक्टर सोनी
नहीं भाई वो ये कुछ ये बोला था, एक्सरसाइज बोला था.
डॉक्टर
तो इसके लिए
आफरीन जब पानी नहीं पीते, राइट, तो जब पानी नहीं पीते तो उससे ब्लैडर को भी इफेक्ट होता है. तो अगर आप पानी के बिना एक पूरा दिन रहो, राइट, तो शायद आपको फास्टिंग के वक्त आपको वो इफेक्ट ना दिखे, पर पूरा दिन जब आप हो पानी के बिना, तो टुवर्ड्स द लाइक एंड ऑफ द डे आपको वो इफेक्ट ज्यादा दिखेगा. तो क्या होगा कि अगर पानी कम है आपके शरीर में, तो उससे अगर आपका ब्लैडर इरिटेटेड है तो फिर वो आपको फिर से वो सब सिम्टम्स आपके चालू हो जाएंगे, लाइक आईसी वाले.
सिम्टम तो है 4 साल से सिम्टम एक ही है, जैसे ब्लैडर में जलन, ब्लैडर की पेल्विक एरिया पूरा स्किन में जलन, यूरिन में जलन और होल बॉडी में जलन, ये तो है ही. लेकिन जब फास्टिंग में रखती हूँ दिन भर कोई जलन है ही नहीं, लेकिन जब फास्टिंग में खुलती हूँ तब धीरे धीरे वो फिर शुरू हो जाते हैं जलन.
तो आप ये बोल रहे हैं कि जब फास्टिंग आप नहीं कर रहे हो, जब फास्टिंग नहीं होता तो पूरे दिन जलन रहती है कि नहीं रहती?
फास्टिंग जब रहती हूँ तब मैं ठीक रहती हूँ, अच्छा फील करती हूँ.
आप अच्छा फील करते हो तो
हाँ.
आप अगर कोई, आई डोंट नो बालका, डू यू हैव लाइक अ nutritionist or someone who can look at her diet, because probably that's irritating her.
Yeah, I'll do that. Gautam Tyagi wants to know, he has put a question in the chat.
So Gautam, weight exercises, it's not that if you go in the gym and do weight exercise it's going to flare you up. It depends on a whole lot of things, where you are to start with. You know, mobility in general is good. If you are doing a lot of, say for example, if you're doing a lot of weight, weights in the gym, right? And then if you don't have proper techniques for those exercises, it might actually lead to a pelvic floor spasm and might feel like your IC is flaring up, if that makes sense. So the important thing would be to make sure that whatever you are doing, it's not affecting your pelvic floor muscles in a bad way. So just have like somebody who can teach you the right way to do those exercises.
Yes. Okay, Dr. Bhakti, would you like to talk about IBS and IC? Because in this group, many patients also suffer from IBS.
So IBS, IC, endo, all of these, the reason why all of these happen together, right? Like it can be IBS or fibro, whatever. Right now we are trying to understand whether IC, like I said when I was there, right? We are going away from the bladder-centric approach. So what that means is, right, it's huge. That means IC might start in the bladder, but now it's like a systemic condition. So it is now attacking all these different systems in the body. So that can go to your whether your IBS or any other system. When you combine these things, the important thing would be to look definitely to heal that bladder lining, that gut line. Actually, you know what? Don't quote me on the bladder lining, because even that we are trying. It's not for all the patients that the bladder lining is affected. But if you have IBS symptoms, IBS, when you say IBS, it's an umbrella term, right? When we don't understand what's going on with the gut, if the doctor says it's IBS, so whether it's true IBS or what's happening, it's important to understand that, and then definitely looking at the diet and working with a good nutritionist will help, not a dietitian.
I just have a question. Now in this lockdown, most of us cannot reach to our doctors, our primary care doctors. So, any relaxation thing that we can do, because most of us are very stressed out at this time, and the stress is causing flares. So, something that you can suggest, just to some breathing techniques or something that can keep us, at least our stress level a little lower, and that can help us with our IBS and
So definitely. So uh, whether in stress or even without, I suggest that all the IC patients or chronic pain patients have some kind of mindfulness or breathing technique that they do on a regular basis, not only when you have flare. Because actually, when you are having a flare, you go into the fight or flight response, right? So you should be doing these things when you don't have a flare or when you are not stressed, so it helps you to reduce that flare cycle. For now, diaphragm breathing would help a great deal. So just focusing on your belly breathing. So like what we did in the sessions, Balaka. Probably you can put those videos up. And then also doing some kind, I don't know if you, so if you go to YouTube, there are a lot of like mindfulness techniques that you can do. So that will help a lot right now.
any other question? Because we are almost coming to the end of the session. Any final questions?
I had a one thing to say about catheterization, right? So when somebody has a pelvic floor spasm, it can lead to symptoms, urinary symptoms, where you have trouble passing urine or difficulty initiating the flow, right? Or dribbling, or like all those urinary symptoms. That might lead to cathing. Cathing repeatedly can cause scarring around the urethra. That can cause pelvic floor dysfunction again and pelvic pain or urethral pain. So it becomes a cycle. So especially in those patients, pelvic floor physical therapy done the right way will help to mobilize the tissues around the urethra and to get out of that cycle. Because for patients who are on repeated cathing, it's important for them or for us to bring them out of that cycle.
Kripa has a question. She's from Nepal. Kripa, please go ahead. Kripa?
Hi, Kripa.
Hi. So I have a question is that in our country, in Nepal, we don't have too much of advanced technologies and everything. So, and I don't know too much of medical terms. And these days I'm having this severe pain in my pelvic area, like in lower back and even in my left leg and yes, left leg. So what kind of physical physiotherapy should I look for? Like what kind of terms, like what should I ask them to do?
Did it
Like
just start, Kripa? Did the pain just start, or it has been going on and off?
like before I used to have pain in my back area whenever I used to carry something like heavy or go up and down stairs too much, but these days it has started a lot, like in pelvic area, in my left leg it has increased.
It might be helpful to actually start from back treatment. It might be the nerve, like there's a nerve which is like it can be pudendal or genitofemoral nerve. So those can lead to the symptoms that you're telling me about, the back pain, the pelvic pain, and the leg pain and all of that. So it might, even if you don't have access to pelvic floor physical therapist, that's okay. Just go to a physical therapist who knows to treat back in a good way, right? And then ask them to just treat your back to start with. That might help.
And I was also planning to join my work after like 2-3 months, but I'm from FNB, so do you recommend me joining back to work or should I still take some time?
I mean,
Like we our job it asks us to stand for long hours, so
if your symptoms prevent you from doing the work that you're supposed to do, you can actually have your doctor give you a note, like your urologist give you a note saying that whatever, like you have these symptoms or you are a chronic condition patient, and to give you some sort of assistance at work where they can give you a chair or something to sit and do your work and let you allow you to do that basically.
and how about like calcium tablets, should I take something like that for my bones or?
I cannot comment on that without, first of all, you need to know your levels in order to even start with anything like that. You shouldn't do it on your own, but definitely check with the primary care.
Yes, thank you.
Sure.
Okay, Dr. Ruchika and Arun both has questions. So Dr. Ruchika, you first, then Arun.
Bhavti, so my doctor has done the maple biofeedback on me, and she does that electrical stimulation. I have been through 5 sessions, and it has helped me. But the thing is that I could not do the rest because of this lockdown.
Okay.
So, how many sessions would you advise? And would you advise that I should do them regularly after a period of time, or should I just stop after I'm better? Like, how do you advise with these electrical stimulations?
It's internal, right? You have
It's
like
internal. So what she does is she puts a stick up my vagina, and she first checks which muscles are tight. She even shows me on the screen that this muscle is tight, this muscle is not. She has given me a blowing technique, and she's given me a few physiotherapy exercises which I do on regular basis. So I do yoga also. So I am doing all my yoga asanas also.
Okay.
And then what she does is she puts that thing and then she gives an electrical stimulation for around half an hour. I have done 5 of.
You're going to a PT for that?
No, she is a urogynac and she does this.
Okay. So yeah. So the way I do it is I do it in the sessions, and then I actually for IC or chronic pain, I give them to do at home. So I ask them to get their own home unit and then keep doing it at home, like intermittently. Like say if they are doing it every day, then now they're doing it like twice a week, or now they're doing it once a week.
Oh, so I can do the electrical stimulation myself, right?
Yeah, and even biofeedback. If you have access to a home unit, you can even do that. That helps you to see where you are at, and then that helps you to basically down-regulate your muscles, pelvic muscles.
So could you tell Balaka, which is like a good machine? I can call it from States when the lockdown opens up and all. So could you tell Balaka, which is a good machine, which I can call for and then...
Definitely, yeah, I'll do that.
Okay, thank you. Thank you so much.
Arun,
I wanted to know, do you think, see, if IC and PFD symptoms overlap so much, often we are misdiagnosed. Maybe many of us have pelvic floor dysfunction rather than uh, interstitial cystitis. Also, I wanted to know, uh, how should we know that it is pelvic floor dysfunction? And sometimes when we have lots of frequency, is that due to bladder spasms?
So pelvic floor so for IC, it's always good to have a multidisciplinary approach and not only treat the bladder. So it always helps to treat the pelvic floor regardless. Your urinary functions, right? Your pelvic floor muscles have a huge part to play for your urinary functions. That means your to keep your continence, to tell your brain that all right, now is a time that you should void, or to allow you to void and all. So because of those reasons, it always helps to treat your pelvic floor muscles regardless. Does that answer your question? So whenever you are having flares, right, doesn't matter where it's coming from, there will be some level of pelvic floor muscles involvement.
Yeah. Also, I wanted to know that due to severe pain, now I'm having problem in mobility. Whole my left side is affected, and I have problem in movement, in every movement, in hands as well as leg. These days, what should I do?
Arun, do you have fibro?
Yes, I have fibro.
Right now, are you on any medications for fibro and IC?
Yeah,
Like,
I'm on
nerve
ketamine
medications.
infusions. I'm on ketamine infusions and on fentanyl patch.
Are those helping you?
Yes, they are helping, but currently I can't go for the infusions. So my pain has started and mobility issues are starting up.
For the mobility issues, especially if you have fibro, right, you have to be in that sweet spot where you are doing something, but then you're not flaring up. So for that, I remember our session in Delhi, I think, and I think with the stretches weren't good, I think, right? So for you, I don't know if you can you go like for just like a short walk outside? I don't know
Yeah.
with the lockdown.
in Delhi, I think they can. In Bombay, it's difficult.
So just not doing any exercises, right? Just do your breathing and just go for a short walk to start with. Don't do any exercises.
Okay.
Just see if that helps with overall just keeping the mobility and just making you feel better. Because
Okay.
mobility in general will help you with everything, like whether it be pelvic floor or just like the nerve issues going on, and even fibro. Because I don't think right now doing specific exercises might help you as much. For you, I'm talking.
Yeah. Thank you.
Yeah.
So anyone else has a question?
Yeah, I have another question.
Yes.
So, very soon I'm going to start my practice, and I'll have to wear the whole PPE and I'll have to practice. And obviously, I will not be able to use the restroom for a while because I'm going to be in that whole gear and all. So, can you advise me, like, would stretching in regular intervals in that case help me? Like, should I regularly do that in between patients?
Definitely, yes. Make sure be aware of the way you are standing, or what kind of practice you have. Like,
I'm a dentist, so I'm standing in all shapes and forms. Like, it's not even funny how bad the postures are when we are working.
so all right, so that is one thing that you actually will have to be aware of and be mindful of. Okay.
Okay.
That
Okay.
because if I tell you that all right, just go and do this stretch, and then for another 8 hours you go back to what you're doing, it's not going to help. right?
Right, right.
So you definitely have to be mindful of what the way you are standing or sitting, right?
Okay,
Only
okay.
standing doesn't help, only sitting doesn't help. Keep switching.
Yeah, yes.
If you have an urge to go to bathroom, make sure that you don't start clenching your pelvic floor.
Yeah, okay.
Doing your breathing would actually help, not clenching and start holding. That get out
The,
of the holding pattern.
like an intermittent breathing or a diaphragmatic breathing, like I do intermittent breathing sometimes, like I do that. So
Yeah, so intermittent breathing or any sort of like relaxation technique,
mindful breathing.
mindful breathing, yeah, any sort of technique, relaxation technique will help you get out of that holding pattern, which is very important
Okay,
for any of
okay.
you guys that are going to go back to work. And if you don't have access to restroom, which I think which probably might not be the best thing to do for you guys, but still, if you are in that condition, make sure that you don't get in that chronic clenching and holding pattern. That can again start the whole like flare up or symptoms.
Yeah, so I have a 6-hour practice normally, right? So what I'm going to do is I think I'm going to split it now so that I can change my PPE or I can just
Yeah,
use the washroom in between. I'm planning something like that. But I would like to do some regular, would like to know if regular stretches and all would be useful in this situation.
definitely. That would
Okay,
help a great.
Here, let me
okay, thank you.
mention that Dr. Soni is available for online consultation. So those of you who are interested.
I'm doing virtual consultations in US and in India. For any of you are interested, I have slashed my prices for all the Indian patients to
Oh,
by a
sweet.
lot. So any of you who are interested, I'm gonna write my email and my WhatsApp number, and then Balaka, I'm sure, will have access to me and the information as well. That's my email, and then I think for US it'll be +1 917. That is my WhatsApp number. If you guys want to get in touch with me, if you have questions or anything.
So I hope there is no more questions. So we can end the session. So thank you, Dr. Soni. Thank you once again for coming. She did 3 amazing workshops for ICI in January 2020, where we did one in Bombay, one in Delhi, and one in Karamsad, Gujarat. And all 3 were, most patients benefited a lot. So we are really thankful to her. So we hope to have such virtual meetings again. So
Yeah,
for
like
now,
Zoom. It's so convenient, right?
yes, it's very convenient. For now, thank you, Dr. Soni.
Thank
Thank you
you.
very much.
Thank you so much, doctor.
Thank you. Bye.